So we've got this preventable fraction we want to address. We know we've got this non-preventable fraction that we're not going to, and that's our kind of accepted fraction. So how do we reduce the risk of infectious diseases? So I guess one of the things that you need to think about is, what do you do? If anyone wants to fire out some ideas, like, feel free, but if you ask someone, what do you do to reduce the risk of disease in your horses? Anyone want to toss out an answer? Keep your barn clean. Vaccination, yeah, so that's the answer that comes up a lot. And I'm going to come back to vaccination. So vaccination is important, but vaccination kind of for me, it's the last line of defense. That's the absolute last thing we want to do to clean up the mess that we couldn't get done with everything else. So vaccination has a key role in infectious disease prevention, but it's just got a kind of a niche role. And you can vaccinate all you want, but if you don't do other things, you're not going to get that optimal response to vaccination. So I think this is a good concept for people to think about. So just step back for a second and think about, what do you actually do to reduce the risk, whether it's hygiene or whether it's practices or whether it's how you move horses, all these things that we'll talk about later. What are you doing right now, and then what maybe can you do down the road? Now, I'm not going to get too boring and academic here, hopefully, with you, but for me, when it comes to thinking about, okay, how do I prevent a disease? There are three things I can address. There's decreasing exposure. If my horse doesn't get exposed to equine influenza virus, it will not get equine influenza. Full stop. Absolutely, right? So if we can prevent exposure of an individual to an infectious agent, we're going to prevent disease. Sometimes that's easy, sometimes that's impossible. Decreasing susceptibility. There are certain things that will make an individual more likely to get sick when it gets exposed to something. Stress, other illnesses, poor nutrition, pain, things that disrupt your normal protective mechanisms, surgery, wounds, that let bacteria, viruses, fungi, whatever, establish themselves and cause disease. That's often really hard to address, but it's something to think about. And then there's increasing resistance. That's largely vaccination. So we're trying to get their immune system better so that when things sneak by, the decreasing exposure, and then we can't control their susceptibility, vaccination is there to clean up the rest. And increasing resistance is there third for a specific reason. So we think about exposure. Well, there are lots of different ways a horse can get exposed to things. Other horses, kind of the prime way. So a horse that's carrying something spreads it to a horse that's susceptible to something. That's influenza, strangles, herpes virus, salmonella, resistant staph. But it's not just horse to horse. Now we have to focus on horse to horse, but there are some other things that can do it. Wildlife and insects. EPM, equine protozoal myelitis, is kind of a classic one there. West Nile virus or other mosquito-borne viruses. Controlling a mosquito-borne disease is completely different than controlling strangles, because of different routes of exposure and infection. But we can kind of group some of these things together. Botulism through food, pretty uncommon around here. Think about the environment, just the horse's normal living environment or the pasture. Tetanus, Potomac horse fever, another cause of diarrhea they can get from water, from aquatic insects. And then there are people. We can actually infect our horses with a few things. Not that many, but there are certain things that can pass back and forth. Rabies shouldn't be on there. We can't give our horses rabies. I'm not sure why that is there. That was copied from something else probably. Okay, so you're not going to give your horse rabies. And if you do give your horse rabies, you've got bigger things to worry about than your horse having rabies. Okay, so routes of exposure. And then we think about sources of exposure. How do they get exposed? Because these are, they sound really basic, but if we can figure out how things get exposed, we can have an action there. Okay, so other horses on the farm, new horses, transient horses, horses you encounter at races or shows or anything else. It's kind of that mixing of horses. Anytime a new individual comes to a group, that's when something new can come along with it. We think about people, and we often forget about people. Vets, farriers, people that are going farm to farm and may or may not be doing what we'd like them to do in terms of washing their hands or changing their things, or they get pooped on by a horse, so they just scrape and go, or do they actually do some type of cleaning and disinfection? If you look at racing, paddock officials, people going on down the line, touching a lot of animals. Things like equipment, wildlife and insects, like I said, food, water, and the environment. So we've got a lot of different things we can consider, but really focusing on horses. Now I mentioned the susceptibility and resistance thing too, so that's the exposure component. To decrease exposure, we think about how they can get exposed and what little things we can do to reduce the risk of that. So we also want to decrease the susceptibility and increase the resistance. So for me, it's kind of, put it this way, here's a normal individual. Now certain things will make that individual more susceptible for disease. So hopefully I'm normal right now. If I get sick from any other cause, I might be more susceptible to another infection. If I go on antibiotics, if I have surgery, if I get stressed. All those other things might make me more susceptible. And there are other things that make me more resistant. Classically, vaccination, but other things that we can do. Maybe immunostimulants. We really don't know how, when, what to use in horses. Probiotics are kind of failing miserably in work, but probiotics still have potential of increasing kind of the gut's resistance if we do them right. And then the susceptible side, like I said, stress, antibiotics, just bad management, inadequate nutrition, and other diseases. So we can control some of these things. We can control optimate management, optimate health. We can try to keep other diseases under control. If a horse has Cushing's, an old horse has Cushing's, you know, the old shaggy pot-bellied horse, if we can control the Cushing's disease, we have a lot better chance of preventing and controlling infections than if we don't have that disease well controlled. And then the other things we can do for increased resistance. Okay, so I've gone over this, I guess, a couple times, but kind of my second concept is vaccination is important, but infection control isn't just vaccination. They're not synonymous. And if we say that vaccination is our infection control program, and that's all our infection control program is, then we're probably wasting a lot of money on vaccines. Because yeah, we might prevent some, but we're really not getting the impact that the vaccines could be giving us. So like I said, it's a third line of defense. It's there when something sneaks past our ability to prevent exposure, and when we can't decrease susceptibility, we can't increase their susceptibility, decrease their susceptibility. So vaccines aren't 100%, and you know this, right? There's no guarantee. The vet's not going to inject your horse and say there's absolutely no chance whatsoever that your horse is now going to get disease X because I vaccinated it. We're not stupid. We're not going to tell you that because that's the horse that's going to get sick. You know it if we say that. But vaccines aren't 100% protective. Not all horses will respond as well as others. And that's just a fact of life, and we can't always identify those. Vaccines aren't necessarily designed to be 100% protective. They're there to reduce the risk. Some vaccines are there to reduce disease or reduce severity of disease, but not reduce shedding of the organism. So it might make that individual animal a little better by not making it as sick, but if it still spews out the same amount of virus, then that's, again, it's only giving us partial protection. So vaccination is good. Don't let me convince you not to vaccinate based on this, but vaccination is just one component of everything we pay attention to. And there are guidelines out there. There's some equine Guelph ones. I didn't actually get a chance to put the slide up there, but AEP, equine Guelph, various groups have vaccination guidelines about what vaccines are available and what to consider. But one thing I have a bit of a concern is people will come up and say, okay, what should I vaccinate my horse against? Or what is your recommended vaccination program is probably the more common question, and there really isn't one is my answer. Because every farm is different and every horse is different. I'm not going to write something out saying this is your vaccination program, everyone can use it. Because different farms have different risks of exposure. Different horses are different susceptibility. If I've got a brood mare, I'm a lot more worried about equine herpes virus coming in and causing abortion than if I've got young animals where vaccination may not really protect against that neurologic disease, and I'm not worried about my gelding aborting, obviously. There are different risks in terms of how the horses are moved around, how they might get exposed, and there are different risk aversities. Some people will say, I want to do everything I can do because I just don't want to deal with that potential where I'm going to get a sick horse and I think, okay, maybe I could have done something else. Versus others say, okay, what's the realistic risk? How many cases do we have? Eastern equine encephalitis is a great one. We have some debates about this. It's a disease that's very, very bad, but it's very, very rare. So some people will say it's very, very rare, so probably doesn't make a lot of sense to vaccinate it. Others will say, yeah, I know it's 1 or 2 horses a year, but they die. And that's bad, so I'm going to do everything I can do. And that's a personal thing. That comes down to designing your own vaccination program because there's not a one-size-fits-all program. You need to think about all these things. And you need to work with your vet on all these things. So what is the core vaccination program for my farm? And are there horses on my farm that will get different vaccines? And that may be the case because there might be some that go off in different areas or are managed differently or have different risks of severe disease or there are a whole range of things that might be relevant. And that's why individual farm and even to the animal level vaccination programs are important. So it's all these things. It's cost, it's risk aversion, it's contact with animals, it's the risk of severe disease, such as the broodmare, again, with abortion with herpes virus, and that overall risk of exposure. My horse, I'm pretty minimalist when it comes to vaccination, because I've got a single pony, lives on my farm with some sheep, and nearest horse is probably a mile or 2 away. So she's not going to get something from another horse, unless something really weird happens. She's got exposure to mosquitoes, lots and lots and lots of mosquitoes, and she's got exposure to wildlife. So I can think about those things, and I can figure out, okay, what is she most likely going to be exposed to? How well do those vaccines work? How much effort do I want to put into vaccination? and come up with a fairly easy program. And that's something everyone really should be doing every year, as opposed to saying it's time for the annual shots, go ahead and do it, send me the bill, and off you go. We're not really doing our horses justice if we're not taking a role in that and figuring and having some involvement in what's done.